Nearly 6 months on from COVID cases starting to be reported in Yemen, the BBC has become the first international broadcaster to reach there and gauge the impact of the virus. Yemen is divided between the Houthi group based in the north and an internationally recognised government in the south. Even amid the pandemic, fighting between the two sides has continued. BBC Arabic special correspondent Nawal Al-Maghafi reports now from Sana'a in northern Yemen.
Here in Sana'a, there is a sense of hopelessness. As we arrive, another victim of COVID-19 is being buried. The people here are faced with the evidence of what this virus does. But this is a country already battling the world's biggest humanitarian crisis. Years of war and starvation have made people indifferent to the threat that is a deadly pandemic. We are the first international broadcaster to get to Yemen since coronavirus arrived here. And this is what we found. There is no social distancing. No one is taking any precautions. I go to a local market. The people tell me corona doesn't exist here. So I ask them if they've had flu symptoms recently.
I did.
Me too. I couldn't smell or taste anything.
But do they go to the hospital?
No way. People die in hospitals. They kill people in there.
But for those in the COVID wards, the pandemic is real and has taken its toll on an already broken health system. Doctors in Yemen have been working with no government salary for years. This is Sana'a's main coronavirus hospital. Dr. Rania tells me because of the high mortality rate, they've been accused of killing the patients who come in.
The patients arrive here in the final stages because of the rumor that we give people sick with COVID a mercy injection.
The scars from working in these difficult conditions run deep.
The patients are our responsibility. They depend on us to live. And we do want them to get better. It is so hard.
Rumors, panic and grief, they all take turns amid an information blackout. We go to a Houthi Ministry of Health conference to find answers. Our crew are the only ones wearing masks. Until today, the authorities here have only announced 4 COVID cases.
Thanks to God, we have been able to overcome it. We followed the plan and the numbers decreased.
I asked the Houthi Minister of Health about fatalities.
Of course, there are fatalities. How many? We will issue the numbers. We have our own strategy.
We left with no answers. Away from COVID hospitals, it's easy to see why a pandemic can seem the least of problems. During our time here, fighting continued. So did airstrikes on civilian homes. That's not all. A Saudi-led coalition blockade has caused a fuel crisis that has left food prices skyrocketing.
Driving towards Sana'a, we've seen hundreds of lorries queuing for petrol. These lorries are carrying food and aid supplies to be distributed across the north. And because of the blockade, barely any fuel is getting in.
And this is the result. Hassan is 8 years old. He's one of millions of children in Yemen who are facing hunger. His doctor tells me that aid is getting so scarce lately that Hassan and other children can't have their basic needs. It's another face of the unfolding catastrophe in Yemen. The world remains consumed in fighting COVID-19. But for the people here, the pandemic is yet another deadly threat for them to survive. Nawal Al-Maghafi, BBC News, Sana'a.